everybody. Welcome to the Spotlight with Sarah. Have you ever had a nagging injury or pain that prevented you from doing the sport or activity that you loved? It stops you dead in your tracks sometimes when you feel that pain. You don't know what to do, so you step away from that activity. Maybe do something that's easier on the joints, on the muscles, maybe become sedentary and haven't gotten back to exercising. Well, in this show, we're going to show you how you can stay active, can stay busy, and healthier and stronger. We're going to be talking to an expert who is going to be helping us how to show us how to protect our muscles, protect our joints, and get stronger and be athletes for more of our lives. So we are going to be doing that and much more. Get your stretchy pants and yoga mats ready. We're going to be talking to an expert when we come back.
Being a soccer player is my identity. So when I hurt my knee, a lot of my identity I felt as if was shattered. It really humanizes you because as a professional athlete, you're somewhat of a freak. And this injury really brings you back down to earth. You're in a very vulnerable position. You have to really trust who you're working with. My physical therapists were essential through this process. Hands down, I would not be where I am today without them. They were able to push me to a point where I wouldn't be able to push myself as an individual. You know, I will be completely honest, there were nights where I cried myself to sleep because it was so hard. But you're never alone. There's always someone there who'd be willing to help you, who wants to help you. I really believe I was put on this planet to play soccer, so when I'm playing, it's like nothing else in the world exists. Now when I play, I'm not playing necessarily just for Joe, I'm playing for everyone who's been through this with me.
Hi everybody, welcome back to the Spotlight with Sarah. We are talking body longevity today and what you need to be doing to keep your joints healthy and strong so you continue to do the things that you love, the activities that you enjoy. Our guest today is Dr. Mark Linkenauger. He is an orthopedic specialist at University Health here in town. Thanks for being with us.
Yeah, thank you for having me.
So a lot of people would not consider physical therapy as something that they should do or something that they would go to if they're in their 20s, 30s, 40s, but people really should.
Yeah, certainly. From 25 to 30 years old, we have a tendency to lose muscle strength, we lose endurance, we become less active. And with that being said, we're going to be setting ourselves up for injuries or problems down the road, especially as we try to continue with activities that we did when we were, again, in our 20s and in our 30s.
Yeah, so I mean, people who run, people who like to do basketball, even golf, triathlon, cycling,
Yeah.
I mean, anybody can benefit from addressing pains or aches, strains that they might be developing in especially their 30s and 40s as we start to get those sorts of conditions.
Yeah, absolutely. Many times we're not aware of our limitations or our risk of being that injury in the future, so it's important to take a proactive approach and see what we can do to maintain that longevity throughout life.
Now, a lot of people don't realize they have limitations that could get them injured. So how do you know, well, what's my limitations and how should I address it?
Sure. So there's definitely some basic things that you could begin with. I'm thinking from working from the ground up. We start by thinking about with our calf muscles, and then working our way up the chain all the way to our low back.
Yeah. So let's talk about working up from the body up, from the ground up. Okay, your feet, you're running, you're whatever you're doing, feet are so important. I mean, they get the brunt of all of the force and work. So plantar fasciitis, that's really a common ailment that a lot of people have gone through. I've had it. I had it for a year. But there is a way to treat it, and there is a way to prevent it from coming back. Can you talk about some of the stretches that help with plantar fasciitis, and why does plantar fasciitis happen?
Yeah, certainly. So thinking of the cause of plantar fasciitis, many times it's related to the load, to the activity that we're doing throughout the day. So it's good to make sure that those tissues stay mobile and flexible. So I'm starting off very basic. We could begin with just some calf stretching. So what you can do is make sure that one leg is stepped back further than the other, toes are straight ahead, and then kind of just going into a stretch just like this, and you should be feeling a nice pull back here through the calf muscles.
So you kind of push against a wall, some sort of
absolutely.
real,
Yeah, if you had a wall, that would be ideal.
Yeah.
Now, also what you can do is if you have a foam roll available, like our model here, that she can demonstrate how you would foam roll your calf muscles as well, and again keep those mobile and help improve the circulation in your legs so that your feet aren't as painful.
So as she's rolling her calves, what should you roll? One leg at a time, two legs at a time?
You could do one or two, really, depending on how much discomfort you're okay with tolerating. One leg usually would involve more weight on the muscle and soft tissue, so that could have a tendency to be more uncomfortable. So maybe starting off with two legs and then working your way on to one, even as you get more experience with it.
And I know another problem that I've had, and people don't realize they have, is just inflexibility in the ankles, which inhibits your movement and ability to move properly, and affects your form. So how do you know you have inflexible ankles, and how do you make them more flexible?
Sure. So these stretches can similarly be used as like a screening. If you go through these stretches or use the foam roll, if you don't feel much of a stretch, and assuming you're doing it well, then it's probably not an issue for you. And the same for foam rolling. If you don't have any discomfort or pain, and that you're doing it with the right technique, then it's probably not a problem area that you need to address.
So these are just really two of the very basic and injuries that we see a lot of people dealing with, and think, I have plantar fasciitis, I can't do anything. It's totally inhibiting. It's painful. So thank you for that information. We are going to be moving from the ground up. We're going to be talking about other areas that people get injured in: glutes, hips, IT band, lower back. So we're going to be talking about those areas and the stretches that can help you recover from pains and aches you may have that are inhibiting your movement and you from doing the activities that you love. So we'll be right back with more on the Spotlight with Sarah.
Surfing's important to me from a mental standpoint and a physical standpoint. It drastically improved my strength, my endurance, my balance. I mean, it gave me a tremendous amount of confidence also, and trust in my prosthetic leg. Before my accident, I had no idea what physical therapy was until I got a whole bunch of it. And what was really impressive to me, and what I could notice, is the fact that I was getting independent again, and I could see this progress. If you want to do something, you just need to figure out a way in how to do it. And I feel that's what all of this has really taught me. The reality is that we're all healthier and happier when we move.
An overuse injury is something that we're seeing that's more on the rise right now, and essentially it's just overloading of the tissues of the body. So when we talk about muscle, tendon, ligaments, and in children we're really specifically concerned with growth plates. Youth athletes are experiencing these overuse injuries now at a higher rate than they ever were before, and a lot of it is just due to too much time on the field, combined with bodies that are not yet ready to take on this kind of force. Common injuries that I see in kids have some typical pain patterns. They complain of heel pain, knee pain, low back pain, hip pain. If your child is really dedicated to their sport, there's a few things that I can recommend. One is to try to make sure that they're diversifying. So even if they really want to be playing for a travel team, for soccer, for example, making sure that they're not getting above those 10 hours of practice per week, making sure they get enough diversification. Maybe one day they're gonna go for a swim in the pool as opposed to being on that field. They also need adequate amounts of rest, and by rest I mean actual sleep. Children are still growing, and while they are sleeping, their bones and their tissues can heal and repair. Another piece of advice I can offer is to make sure that your coach and your team incorporates an adequate warm-up and cool down. This will help prevent many of the injuries that we do see on the fields. And lastly, you should seek out the services of a physical therapist. First and foremost, the PT is going to help in the education piece with the parent and the coach and the athlete and let them know why the injury may have happened. The physical therapist can also really help with the current injury and further prevention of injuries that may happen down the road by specifically working on your child's cardiovascular fitness, their muscular strength, their endurance, and their coordination and agility to get them back onto the field in a safe and timely manner.
And welcome back, everybody. We are moving up the body and talking about aches and pains along the leg, the lower back. We're talking about pains in the glute and also the hips. What can you do to relieve that pain that can just stop you immediately from doing what you love, whatever that is? We have got our specialist today with us, is Dr. Mark Linkenhagen. Thanks for being with us. You're going to talk about a lot of these pains as we move up the body. Now, IT band. That's one that you just hear of a lot. I mean, a lot of people have had problems with IT band. Everybody from a pregnancy, people who run. I mean, the IT band is not a muscle, you said.
Right, correct.
What is it?
So the IT band is more of a connective tissue linking the lower quarter to the upper quarter as well of the body. Many times the IT band becomes tender and painful, however, though, due to flexibility issues in our upper or lower body, as well as it can be playing a role due to muscle weakness also.
So how do you stretch that?
So as far as stretching the IT band goes, if you have a foam roller available, that would be a great option to help improve circulation in that area and get that tissue moving as well. So you could use a foam roller just like this and work in between the hip, coursing down to the knee where the IT band runs, and that could be a good way to help.
And you don't have to wait. You don't have to wait until you're injured. Just get on it before you work out, after you work out.
Sure. It's good to do a good warm up and even a cool down. But again, stay proactive. Stay proactive about taking care of your body and kind of screening these different areas in your legs to see if you may have some issues or may be at risk for an injury down the road.
And now everything's connected from the feet all the way up to everything to your lower back. So lower back pain, that's something else that a lot of people complain about no matter what you do at work. I mean, if you're cycling, golf, people deal with lower back pain. So how do you relieve that?
Yeah, so speaking to moving up the chain, make sure again that you have good calf flexibility, that you don't have any IT band issues, and then again you can work on stretching your hamstrings and seeing if those are flexible as well. So you can position yourself just like this with your feet together, and then again just kind of taking your rib cage towards your toes and feeling a stretch. You should feel a stretch back through the
back of the legs,
or even in your low back, really whatever area is tighter. That's where you're going to feel it first.
Yeah.
And then also you could address each leg one at a time. If you just separate your feet a little bit, say by 3 or 4 feet, and then just going from side to side. You could hold the stretch for 30 seconds, 60 seconds, kind of whatever you're more comfortable with.
Yeah, and this one you can do standing too, right?
Yeah, exactly. Yeah, you could do these stretches in standing, and again, just a nice way to to get in a warm up and stay flexible and be able to run or get into whatever activity.
And don't wait till you're feeling tight or you feeling like there may be a pull there. Just this is something you want to do before you work out, during your workout, after your workout.
Yeah, the best treatment is addressing things before they become a problem, really. So if you can go through these stretches, get your body prepped, and then again you'll have a much better performance.
So I love running. I've been a runner for a long time. A lot of my problem areas have also been my hips and my glutes. They get really tight. How do you stretch out, for example, your hips?
So a couple good stretches to keep in mind for your hips, for your glutes is you could be on the floor again. This is a more of an advanced stretch for the glutes and the backside of the hip, called more of a pigeon pose as well. That can be really helpful. Again, holding these stretches for 30 seconds, 60 seconds, whatever you are more comfortable with, they'll definitely be effective. And doing that on both sides, and then also what you can try doing is laying on your back. And we call this a figure 4 position, where you cross one leg over the other. And then again, you should feel a stretch on the back side of the hip there in your glutes, and then drawing the knee up towards your chest using your hands as the force.
And that's very helpful.
Yeah, absolutely.
Now, how about people who have complained about like inner thigh, like tightness in your inner thighs? I know that I had a lot of problems with that cycling. Of all things, it was really weird, but you should stretch your inner thighs too, and there's a couple different ways to do that.
Yeah, so a couple stretches to keep in mind for the inner thighs. If we start on the floor, this is called more of a like a frog pose. Is you're going to be face down, and then drawing your knees out to the sides, and then just keeping your knees below the level of your hips. Your feet will be on the floor, and then you should feel a stretch like through the groin, and again in the inner thighs, like through those adductor muscles also.
Right. And you go from that area up to your psoas muscle, and that's another area that gets super tight, especially it seems like a lot of women have tightness in that area, but I guess men do too.
Yeah, certainly. I think we all experience that, just related to our job or different activities that may dispose us to those problems as well. But it's a really deep muscle, and a good way to address that is if you have available, it's what's called the psoas, and that could get deep into that that area, which we can give you a demonstration of, and then also taking into consideration like where the pain's at, that could determine how you use this piece.
How you lay on that psoas.
Yeah, exactly. Kind of just get a feel for your body and become more aware of where your problem areas are.
And you move slowly. Right, slowly.
Yeah, just ease into it. Make sure you're taking deep breaths and working into it.
Now, there's also a way to stretch your psoas muscle without any apparatus. You can just do a body stretch.
Yes, yeah, absolutely. So with the psoas stretch, you can be in more of a half kneeling position. So one knee's on the ground, the other leg is forward, so it's kind of like a genuflection position. The front knee will be bent, and then you'll just be going more into like a lunging type movement, and then to lengthen that side, you could kind of come up, and then side bend away from it also.
Okay. So all of these moves, all of these stretches, helping us get stronger, stay healthy, and keep on running, keep on cycling, whatever it is that you love to do, right?
Yeah, absolutely. You want to move. You want to move well, and you want to move often.
So you mentioned the psoas. Well, there are a lot of devices out there available to help you stretch, to help you get to that pain and get to it and resolve it once and for all. Well, do they work, and are they worth the money? So up next, we're going to be taking a look at some of the popular things out there to help athletes recover from aches and pains. We'll be right back.
I have torn my right meniscus, torn meniscus in my left knee, rotator cuff in my left shoulder, and the big one, spinal stenosis between L4, L5 lower lumbar. When my back was taken away from me, then I could barely run. The leg just stopped working. The physical therapist bought into what I was trying to do, run. He knew what was going on. He tweaked my running style. It's allowing me to resume normal life activities. I want to be accepted as normal. I don't want to display the one thing I can't do, and that's see. And sitting still just wasn't it for me. Now I have spring in my step. I feel much better because of who and what I am and the physical therapist.
Welcome back, everybody. And look, check out these devices. Oh my gosh, look at this big guy right here. This is the Theragun. We have a So-Right, we have bands, we have a foam roller, just a few of the things that are out there on the market that people can use to help them recover, to give them some relief from a lot of those aches and pains you get from the running and the cycling. Now, the Theragun is one of the popular ones. There are different brands on the market too of this.
Yeah, there's different brands on the market, and this type of gun is actually becoming more popular as well. You see it at a lot of different places, and can use it really all over your body, from your neck down to your feet.
And is this like a massage?
Yeah.
It feels great, you guys.
Yeah, it's just like a massage, and again, helps improve the circulation. It can decrease the pain, and help keep you mobile as well. Again, getting your body prepped, before your activity of choice, or also just the way afterwards. The target gun, if you prefer it, you could take that option. What we have out here with the foam roll, for example, these really target a lot of they all have the same goal in mind. It's just a different way of how you want to achieve that goal.
The So-Right is also kind of one that works on your psoas. You lay on it.
Yeah, that gets into much deeper tissue layers as well. Your psoas muscle, and again, that it helps kind of target some of the muscles that hook to the low back and then cross the hips and then come down here into the thighs. Have you seen these out in the market, or is it surprising to you that the more and more that we're seeing come out? I mean, items that can help you recover and get better? Yeah, so all these are fairly common. Usually our patients come in talking about using these in advance, or sometimes we do introduce to them as well also. So, and
the foam roller is a real popular one. It's really good for a lot of things.
Yeah, the foam roller again can address a lot of the issues that we've talked about today as well, and it's one of your more affordable options as well, and maybe more readily available to to purchase compared to the price that you may find one of the Theraguns at.
So the bands, y'all like to use these bands a lot in physical therapy?
Yeah, the bands are more for maintaining like strength and stability as well. Sometimes you could use them to go through a different series of stretches as well.
Yeah. So if somebody was going to invest in something, start with something, what should they start with something that is affordable first?
In regards to staying flexible and keeping your tissue mobile, I believe the foam roll would be a good place to begin. It's a more affordable option. Again, you can find it more available compared to the price potentially of the Theragun. And
what do these range in price a lot?
Yeah, I've seen quite a wide variety, really depending on the seller.
I mean, I think I've seen some maybe I don't know, $120 to $600.
Sure. You'll see a wide variety out there. So I guess it would just be wise to shop around a little bit and see what's available. Yeah.
All right, great. Well, a lot of products that people can use to get better. So we appreciate your perspectives on how they work and if they're worth it. So it just depends on where you are in your fitness journey, and if it's something you want to spend, and if it's something that works for you. And you also recommend that if somebody has one of these, a friend maybe borrow it from a friend before you buy one. See if you really like it.
Try one through a friend first before you make a purchase, just like taking a test drive, and see if it's a good fit for you before you make your investment.
All right, well, thank you, Doctor.
All right,
so we've got more coming up here on the Spotlight with Sarah, so don't go away because we'll be right back. And welcome back. I hope you're feeling the stretch as you've been watching the show and are feeling a lot more flexible after listening to the doctor talk about the importance of stretching and all the things that we need to be doing to keep our bodies healthy and moving along as long as we want to be running and cycling. So I want to thank Dr. Mark Linkenauer for joining us today and sharing all of that information with us.
Yeah, thank you for having me.
So where can people go if they want to find out more about stretching and what you've talked about?
So really things that we've discussed today, and a tremendous resource that's available is called choosept.com. It's CHOOSEPT.com, and it has just such a wide variety of resources available, great articles, anything that you're interested in, podcasts related to activity, anything involving physical movement that could be a great resource and again help you stay active.
Now, what if people want to go see a PT?
Now, if you're interested in seeing a physical therapist, the easiest way to get an order is just to talk with your primary care doctor, and then they can just write you an order for physical therapy. It's really a quick process, and with telemedicine so popular now as well, it could just be a matter of a day or so before.
And
you can
University
get in.
Health does a lot of this stuff.
Yeah, so University Health, we have multiple physical therapy clinics throughout the greater San Antonio area. And we take care of folks of all age ranges, activity levels, whether you're in sports or whatever the case may be. We have a wide variety of experts and specialists as well, and would be happy to serve you.
All right. Well, thank you very much, Doctor. We appreciate having you on the show today, and hopefully you all were able to take away something that you can use, doing something that you love, and to help keep you moving and keep you active. So thank you so much for joining us today. And on the next Spotlight with Sarah, we're going to be talking about how women look red carpet ready with a simple, quick visit to the dermatologist. We're going to be looking at some of the latest cosmetic beauty trends, and that's coming up on the next Spotlight with Sarah. Thanks so much for joining us.